Good morning to all of those who make this broadcast possible. To Raul, to our sign language interpreter, and to everyone tuned in to this briefing. Today, 1,171 people are hospitalized in Cuba. 47 are under observation. There are 579 suspected cases and 545 confirmed active cases. Yesterday, 4,261 samples were processed in our various molecular biology laboratories. 1,313 were processed at the Pedro Curie Tropical Medicine Institute, 815 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 634 in Havana's, 278 in Santiago de Cuba's, 546 in the Genetic Engineering and Biotechnology Center Lab, 276 in the Civil Defense Laboratories, 151 in the Fructuoso Rodriguez Hospital, 93 in the Naval Hospital, 93 in the Molecular Immunology Center, and 62 in the Manuel Fajardo Hospital Lab. Of the samples processed, 35 tested positive for SARS-CoV-2 and COVID-19. That's 35 people. This brings the total number of samples processed in the entire country since the pandemic began to 365,353, of which 3,717 people have tested positive for the virus. As I always mention, samples from all of the country's provinces were tested. 98 from Pinar del Rio, the largest amount, 2,872 from Havana, 159 from Matanzas, 125 from Cienfuegos, 265 from Villa Clara, 130 from Camagüey, 101 from Holguín, and 131 from Santiago de Cuba, for a total of 4,261 samples. All of the 35 positive cases diagnosed yesterday are Cubans. 32 of the 35 are confirmed case contacts. 91.4% of all cases diagnosed yesterday, therefore, had contact with someone who had previously tested positive for the virus. Of the 35 diagnosed cases, the source of infection linked to 2 is yet to be determined, for a total of 152, or 4.2%, of cases of this kind since the pandemic began. Nonetheless, over the last 15 days, we have managed to reduce the number of cases where it has not been possible to determine the source of infection to 49. 40 from Havana, 5 from Artemisa, 2 from Matanzas, and 1 each in Villa Clara and Holguín, which, despite all the work that has been done from an epidemiological point of view, the source of infection remains unidentified. Meanwhile, the source of infection has been determined in all other cases, an important achievement for our work and efforts to control the spread of the virus. Yesterday, 1 of the 35 people to have tested positive for COVID-19 contracted the virus abroad. This case relates to an individual who recently arrived in the country and was put directly into quarantine without setting foot in their province. They were then tested and the COVID-19 diagnosis confirmed. Of the 35 diagnosed cases yesterday, 15 are male, for 1,865, or 50.1% of all cases. Meanwhile, 20 are female, representing 49.9% of all diagnosed cases on the island. As you can see, the rate remains practically the same between both sexes, although there are days when we see a higher number of female cases and others when there are more male cases. 15 of the 35 cases yesterday were asymptomatic at the time of testing, representing 57.5% of the total. A slightly lower figure than we have seen over previous days, but still a significant number. It is true that the percentage of asymptomatic cases has reached 70% or more. However, 57.5% is still a high number and a characteristic feature of the illness. By age group, 3 positive cases diagnosed yesterday are under the age of 20. 16 are between 20 and 39 years of age, 8 are between 40 and 59, and 8 are over the age of 60. Notice how 19 of the 35 cases, that's over 50%, are young people, or people under the age of 39. Of the 35 positive cases yesterday, 32 belong to Havana, 2 to Pinar del Rio, and 1 to Mayabeque. The case from Mayabeque is imported and not the result of local transmission. It therefore does not count toward the province's overall confirmed case rate. The 2 cases from Pinar del Rio both belong to the municipality of La Palma and are confirmed case contacts linked to an outbreak in the locality. Regarding Havana, of the 32 cases belonging to the province, 10 are from Arroyo Naranjo, 4 are from Boyeros and Cerro, 3 from Habana Vieja and La Lisa. There are 2 from Habana del Este, 10 de Octubre, and Marianao, and 1 case each from Plaza and San Miguel. As you can see, cases are spread over a large area and many municipalities of the city. Yesterday's results therefore mean that Havana continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, standing at 27.63, higher than yesterday's. Artemisa follows with a rate of 14.18 per 100,000 inhabitants. Then Pinar del Rio with 5.65, Villa Clara with 2.19, Las Tunas with 0.75, these last 2 provinces with a lower rate than yesterday's. Then comes Matanzas with 0.69 and Mayabeque with 0.52. similar to yesterday's rate. This means that Cuba has a rate of 6.47 per 100,000 inhabitants, only slightly lower than yesterday's figure. These are the statistics for the rate of confirmed cases per 100,000 inhabitants over the last 15 days, not the overall rate since the pandemic began. To summarize, of the 3,717 people who have been diagnosed with the virus thus far in Cuba, 545, or 14.7%, are active hospitalized cases. 524, or 96.1%, are clinically stable and responding well to treatment. Cuba has registered a total of 91 COVID-19 related fatalities since the start of the pandemic, but no deaths were reported yesterday. This means that the island has a mortality rate of 2.44%. When we compare this with the global rate of 3.46%, Cuba places 111th in the world. When we compare it with the regional rate of 3.55%, Cuba occupies 21st place. Yesterday, 35 people were discharged from hospital, an equal number to those who tested positive for the virus. 16 of those discharged were from Havana, 13 from Artemisa, 2 from Pinar del Rio, and 1 each from Ciego de Ávila, Las Tunas, and Guantánamo. This means that, to date, 3,079 people, or 82.8% of all confirmed cases in Cuba, have recovered from the virus and continue to be monitored by our healthcare professionals. Today, 2 patients continue to be in a critical state, with 19 reported as serious. These figures are very high, given the low numbers we had previously achieved in the country. They also correspond to the high number of cases reported over recent days. The critical and serious patients are all from Havana and are being treated in intensive care. They are receiving care in accordance with established protocols, medications, and treatments. This has meant that yesterday, one of the patients previously reported as critical passed to serious. However, another individual joined the group of serious patients yesterday. Now we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 266,222 people were diagnosed with the virus, for a total of 23,243,621 confirmed cases since the start of the pandemic. Yesterday, 5,419 people died of the virus, for a total of 805,714 COVID-19 fatalities and a global mortality rate of 3.46%. The region of the Americas, epicenter of the pandemic for several weeks now, accounts for 53.72% of all COVID-19 cases worldwide. That's practically 54%. The region reported 139,000 329 new cases yesterday, for a total of 12,465,424 confirmed cases. A high number of deaths were also reported in the Americas yesterday, 3,536, bringing the regional COVID-19 death toll to 442,941 and a mortality rate of 3.55%. Just like yesterday, the United States continues to top the list of countries hardest hit by the pandemic, followed by Brazil, India, Russia, South Africa, Peru, Mexico, Colombia, and Chile. Notice how 6 countries from the region are among the worst affected in the world. To date, the United States has reported over 5,678,000 cases of COVID-19. Brazil has over 3,582,000, and India more than 3,044,940. All 3 countries also have a high death toll. The US with over 176,000 COVID-19 related fatalities, and Brazil with over 114,000. These are all important numbers and a reflection of just how difficult it is to control this virus. This is the information that we have on the behavior of the pandemic in Cuba and the world.